Go. Cheyenne, you are the first official episode of the Strength Movement.
Nice.
Congratulations.
Thank you.
Inaugural. I don't know if Cam counts, but Cam is like the frequent guest, even though he's coming next. And he did the first one, but welcome.
Thank you.
This is the first one.
I know. Excited to be here.
So, who are you?
Yeah. Big question.
Big question.
My name is Cheyenne. I am a gymnastics coach over at North Coast Gymnastics. I also coach strength up in Ferndale at Gymstar Sports Center. And I also coach some CrossFit classes a few times a week. So lots of coaching for me.
Yeah. What Cheyenne refuses to tell you is that she's also a very high level CrossFitter and former dancer.
Yes. And former dancer. That's right.
Big dance.
Yes.
Dance was the thing before CrossFit and before gymnastics.
Yeah. Dance I started when I was 3 years old. And that was really the only movement experience I ever had until after high school, really. After high school, so I did high school drill team. So we did a mixture of pom, which is jazz with pom-poms. We did military, which is just sharp precision movements synchronized with the whole team. And we competed in that for the state. And that was super fun. It was a really great experience to work together as a team. My last couple of years, I was able to help lead the team through our whole season. So that was really cool. It was an awesome experience for me. After that, I came to Bellingham and went to Western. And I wanted to give myself some time just to acclimate to school. So I basically stopped dancing for a couple years. And I knew I still needed to stay active. And so I forced myself to go into the rec center at Western. And I never had a weightlifting background or anything.
So before the rec center, no lifting?
No.
No barbell, no dump, no nothing?
Nothing.
Just dance?
Yep.
Just body
dance.
weight?
Mm-hmm. Yeah.
Interesting.
So going into the rec center, I would do a little bit of cardio on a machine and then maybe do a 30-minute ab circuit, kind of how everybody.
Perfect.
Yeah, perfect. Sweat a little bit, get a little bit of core work in, and then I was kind of done. I did that for a couple years. I would say maybe 2 years or so, 2.5. And then I finally and then I joined the dance team at Western.
Oh, sweet.
So I was a junior when I joined that because I was I miss dancing. I feel like I finally have my feet on the ground in college. It's time to add something.
Yeah.
So I joined the hip hop team and it was such a fun experience. That was non-competitive. It was just performance based. So we did.
Pre-college was all competitive.
Yes.
Super duper.
Yep.
You show up.
Oh yeah. 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 We show up. We had practice every single day. 2 days a week we had morning practice before school. And then 3 to 4 days a week we would do after school. I think in total, it wasn't gymnastics hours in the gym, but it was definitely a lot of practice time.
Wow.
Throughout the week. Yeah.
And then when did you get into lifting and CrossFit stuff?
Yeah. So I would say I really started to get into lifting the summer. It was the summer after my senior year, basically.
Of college?
Yeah, of college.
Okay.
Yeah.
Is that when we first met? Because was this CrossFit X?
No, we met a year later.
Okay.
Yeah, after COVID. So I first got into lifting. A friend of mine was a personal trainer, and she was just starting up her business, and I reached out to her for some programming.
Awesome.
Yeah, and it was super great. She got me out of my comfort zone and got me doing movements that I had never done before in the gym. And I remember there was one time she programmed 5 sets of 5 burpees, and it was
that was your workout?
Well, it was part of it.
Yeah.
But I remember looking at that and doing it, and I was like, this is the worst thing ever.
As most people do when they first see burpees on
totally.
the list.
Yeah. But anyway, she started to get me a little bit more comfortable with all the equipment and dumbbells and barbells in the gym.
Yeah.
And so I'd have to send her videos because she wasn't local.
Oh, sweet.
Yeah. So it was really, she would give me the programming. She would explain it to me, and it was on me to go do it.
That's a lot to learn movements for the first time remotely.
Yeah. Yeah.
That. I'm just picturing how much cueing we have to give people with a squat. You know this.
Totally.
Squat, deadlift, all the things, bench press, they're all technical.
Yeah.
And so to imagine you doing that with a remote coach. She must have been either a good coach or you must have been a good advocate for yourself to like learn how to do it properly.
Yeah, I think a mixture of the two, definitely. Nice. My degree's in kinesiology, and so I've always been very aware of like whenever I'm doing a movement, I want to do it correctly.
Yeah.
And so that was really important to me going into that, just to make sure, hey, am I doing this right for one? And for two, you know, what am I doing it correctly anatomically? And then what can I do to build?
Did you like if your degree was in kinesiology, so you must have known the inherent benefits of strength training pre-lifting? Like, was it just something you always wanted to do and just never did the thing?
That's a really good question. I did
Welcome
not.
To the strength
I know.
Movement. We asked the hard-hitting questions.
So I did know going into college that I wanted to be a physical therapist.
Oh,
was my original goal.
Hey,
yeah.
There you go.
Yes. So that was the original goal. So I always knew that I wanted to help people get back to or to move better, get back to their sport or get people to move better. And so that was my goal going into undergrad was I was like, I want this degree so that I can further my education.
Help people.
I want to help people.
Cool.
And I want to make sure people stay active.
Yeah.
And so through college, I had, my first 2 years were, GORs, that kind of thing.
Yeah.
But junior year was really when I got into all the kines classes, and it was, if I had to go back, I wouldn't pick anything else. Like, it was absolutely my favorite education I've ever gotten. And it's because it's something I'm so passionate about.
Right.
So,
it's cool that you do that even now with coaching.
Yeah.
So you picked up lifting later than you possibly should have after the education.
Yep.
What got you transitioned from lifting to CrossFit?
Yeah. So that summer that I was lifting at the rec center, it was right after I had graduated college.
Okay.
So it was the summer after I graduated. I still had a membership at the rec center. And so I'd go in and lift every once in a while. And I had also just started a new job at a physical therapy clinic.
I remember. Yep.
Yes. And we weren't even friends yet, but one of my coworkers did CrossFit.
Okay.
It came up in conversation. And I went up to her one day and was like, can I come to a CrossFit class with you? I've always wanted to try it. And she looks at me and she was like, yeah, sure. I go every day at 4:30. And I was like, okay, I'll be there.
That casual. Just like, yep.
Yep, totally. So I just went into this CrossFit class. It's just a big warehouse.
Yeah.
Empty.
Yeah.
I walk in. It's kind of dark in there.
It is.
It's a warehouse. So I walk in and I see all these like super fit people. I am not one of those super fit people yet at this point.
Yet.
Yeah.
Yet being the key word.
So I walk in. Luckily, I'm with my friend. So I had someone to kind of cling to.
Yeah, of course.
But it was the most humbling experience going through that CrossFit class.
I don't think you're alone in that statement. And I think also if you are willing to try CrossFit, it really helps to have someone with you.
Totally.
Just to be like, this is going to kick your ass.
Yep.
I'm right here.
Yep.
You can, and it's also because the environment is so different than like your typical gym.
Yeah.
Like, it is not looked down upon to sweat all over the place. And like, it's just a different environment. And I think nobody's self-conscious about like what they're doing.
Right. Agreed. Yeah.
Because they're all suffering so much.
Yes. Because that's the thing about CrossFit is like, everybody's in the workout together.
Right.
You're doing it together and it sucks.
Yeah.
And everybody knows it sucks, but everybody gets through it. And then at the end of it.
And that builds the community that it is.
Totally.
So you get into CrossFit.
Yep.
And that is when I meet you for the first time. I remember meeting you for the first time during a Zoom.
Yes.
That I was doing through that CrossFit gym, CrossFit
X.
During COVID, my business was like just trying to figure it out. And so
As all
like,
businers were.
and I'm just like, I'm going to do movement and I think it was
mobility.
Like mobility classes through Zoom for the gym.
Yep.
And I think you popped in to one of them. And that's when we met.
Yeah.
In the heat of COVID, when I had a 6-week-old daughter and was just trying to figure it out. Okay. And then since then, I've seen you a few times for PT. Obviously friends. you're getting married. I'm going to be there. It's going to be awesome. But as a clinician and as a patient, you've seen me a few times. None bigger than this most recent kind of run.
Yeah.
Right. So like I've seen you for your shoulder and
Yep.
hip. All like I remember the shoulder was like purely musculoskeletal. You know, hip. You could make the argument led into what we're dealing with now. So tell me, I want to focus today on the back because clearly that was the most devastating. That was the biggest. That was the most emotionally draining.
Yeah.
If you will.
Totally.
Tell me about that. Or at least start from the beginning. Like, okay, I forget when it was when that started, but like
February.
what happened? February.
Yes.
Shannon's like, it was February at 8:32 p.m. This moment.
I know exactly when it happened. And I remember, so every time I feel something a little bit different in my body, whether I'm lifting or doing yoga or whatever, I always try and make note of when that is, because if it does turn into something else, I always like to know like a timeline. So
that's a really good tip for anybody. Data. Like having data as a clinician is so important to know this was the thing, this is what I felt, this is what I was doing.
Yep.
Awesome. Cool.
Yes.
Anyway, go on.
Yes. So February, it was early February, I remember. And I was actually just about to do a competition with Susan. So her and I were partners.
Yep.
And we were about to do this CrossFit competition held right at our gym. It was going to be a super fun event, or it was a super fun event. And we went in, I think it was the Sunday right before that competition started. Right. That next weekend. And so we're in the gym on Sunday, we're trying out some of the workouts, and all of a sudden we get to the deadlift workout and I notice, I'm like, man, my back's really hurting. I can't even deadlift 55 pounds off the floor. And we're supposed to be deadlifting 155. So
woof.
Yeah. It was a very noticeable like, like something is not right. And so my thought process was, okay, something's not feeling right. I have a comp this weekend. I'm going to go light today, this whole week, try and rest it up.
Yep.
And then I'll bang it out for the comp.
Assuming it's muscular.
Yes. Assuming I just like overdid something and with a few days rest, it'll be fine. So I did exactly that. And the day of the competition comes around and I'm warming up and I'm like, oh yeah, my back's not feeling like 100%, but it's okay. I can push through.
Right.
And I did. I pushed through just fine. I was in pain the whole time. I remember one of the first workouts was a 1 rep max squat clean or something along those lines.
I remember that. Yep.
Yes. And I remember doing my 1 rep max and I actually PR'd my squat clean that day, but I was in so much pain. I mean, you can't even tell whenever I look back at the videos. Adrenaline totally took over. But I do remember being in pain. But then I looked back at the videos and like, it looks like I could have done more weight.
Yeah.
But that was a PR for me. And I was like, sweet, I'll take it. Like 175, that's amazing.
You squat clean 175?
I did.
Hell yeah.
I have the video to prove it too.
Who cares about a back injury? We hit the number.
Right? Anyway, so I go throughout that competition, in pain, but I made it through. And after that, the next big thing was the open.
That's right.
Yeah. So after that competition, I was like, okay, back's still not feeling good. Same thing. I took a few days off of using my back. So I would still come into the gym and do some cardio, like some bike and some arm, shoulder stuff. But I was not squatting or trying to deadlift anything at that time. And so finally the open comes around. When was that? End of February?
Yeah. I think open was either end of February, early March.
Somewhere around there. And I was like, okay, I'm going to do the open. I'm already in PT at this point.
So I'd already started seeing you.
Yes. Yeah. So I had already been in PT. I think it was right after that competition, or right before. It must have been, I think, right before that competition. But anyway, so I
remember there being some urgency. I remember being like, I have this thing.
Yeah.
That's I didn't know if it was pre the CrossFit comp or pre the open. It must have been pre the open.
Yes, it was. And so I competed throughout the open. Obviously for a couple of different reasons. Not my best performance. Yeah. And so I had to do a lot of reflection there. And then I did make it to quarterfinals, which I was super excited about. And before I was done with the open, I really had wanted to do the quarterfinals.
That was the goal.
That was the goal.
Yeah.
For sure. Yeah. After the open, my back was even worse than it has been.
Yeah.
And so I had to take like a really hard look at what I want my sport to look like throughout my whole career. Mm-hmm. And I didn't want it to stop. I was not ready for it to stop. Yeah. So once the quarterfinal workouts came out, I took a look and was like, you know what? I'm going to skip the quarterfinals this year because...
In an effort to increase your longevity in the sport.
Correct.
So you knew, you're like, okay, if I push this line, there's a chance of doing something that would inherently shorten my long-term ability to do this.
Yes, absolutely. And I 100% believe that that is still the case. When I was in PT, I couldn't even lay on the bench and brace without pain. It hurt to brace.
I remember going through, and again, there's specific flashes of your care that I remember, and one of them was like, we just need to find positions where you're not hurting.
Yeah.
And I remember just being like, because I remember it was like, as a PT, we go through like flexion bias, extension bias, like when we're trying to diagnose a back injury, and yours was complicated because it was also related to some hip stuff.
Right.
And it was, you're flaring in flexion, you're flaring in extension, like we're just hunting for relief. Mm-hmm. And I remember just having you on the table, legs on the wall.
Yep.
Like in this like weird half happy baby position.
Yep.
And it was just like this, like, okay, this is the best it's felt.
Yeah.
I'm like, stay.
Yep.
Like we were at that point of like inability to function.
Yeah.
Where it was like, if you're there, your session is going to be 5 minutes of just being in this pain-free environment.
Yep.
And just like enjoying not hurting.
Yeah.
Like I remember that moment.
Yeah.
Tough place to be.
Yeah. It was really hard. I mean, I couldn't even walk without pain.
Yeah.
Like every step I took, it was just excruciating pain. And the pain I was feeling was like a shock or like a shooting pain that was going down my left glute. And I mean, I'm a coach. I coach kids all day long. And so I need to be there to make sure that they're not going to hurt themselves.
Right.
And so lifting and spotting was not an option anymore. I couldn't even walk. Like I remember I was coaching a class and I had to spot a kid through a bridge. And so what I had to do was lift the kid's hips up.
Right.
And I remember I was in this like half kneel, bracing, lifting the kid's hips up. And I remember feeling like my spine was going to shoot down like into the floor because of how much pressure. I mean, it wasn't that much pressure, but just because of how painful it was, like it literally felt like my spine was going to shoot out from under me.
Jeez.
Yeah.
And it's not, and again, I say this to you're someone that's experienced injuries on a superficial level. So this is not like your first go around. So
right.
I say that to say like, good and bad and like that some pain is normal and not.
Yes.
Like this was like, you're not inexperienced to like occasional pain here and there.
Right.
This was like big. Yeah. And so I mean, we talked about this in real time when it came to the quarterfinals. Mm-hmm. And I agree with you 100%. At the time, you were so sensitized to pain and so acutely flared in your back that you have one of those like go muscles in your brain, which is like, if I'm going to do this thing, I'm going to do the thing.
Yeah.
And kind of turn everything off.
Yep.
And in the moment, you absolutely could have, I don't know if I would have say like reduce your long term, but at least you would have prolonged the injury.
Right. Yes. Right? It would have definitely hung around longer.
I would say that was probably some of the times where I saw you at like your darkest, not darkest, but like most vulnerable.
Totally. I was in a dark place.
Yeah.
It was funny. I was actually explaining this to someone just the other day, but whenever I was going through like the grunt of it, I couldn't do the quarterfinals. And my back was like a 12 out of 10 for pain. I was trying to explain to someone how devastating and heartbreaking it is to not be able to do the thing that you love that is the thing that's supposed to ground you.
There is a mental component, and I treat a lot of people that are very physical and use sport as their thing. And a lot of times the part that's neglected is we treat the physicality and not the mental component. Because a lot of people that I treat in particular use physicality or use that sport as their mental reprieve from everything else.
Yes.
CrossFit is a big one.
Yeah.
Where like not everyone is competitive like you are, but the people that use it as a mental break from the stressors of life. And so when you take that away, now all of a sudden, not only are they hurting, but they don't have the thing that usually makes them feel better.
Right.
Like the weapon that they use to feel better for themselves is physicality.
Yeah.
And now you're saying like, not only are you in pain, but the thing that makes me feel better normally is not available.
Right.
And that can lead people into some dark places.
Yeah. Yes. I definitely was not myself during that time.
Yeah. So when, like emotionally, because there's two parts of it. One is the physical, and we'll talk about that. But like emotionally, how did you find yourself kind of like pull through that? Like, did you have any weapons that weren't physical that like helped you kind of get through it without going all the way down?
Yeah, I would say, I mean, obviously it varied week by week, day by day, depending on my back pain. There were days where I could start to see the light at the end of the tunnel. Yeah. I was walking without pain. Something very small. And I was like, wow, maybe one day I'll be able to do CrossFit again. And then there were other days where I couldn't walk, and, you know, it just kind of, I spiraled down this rabbit hole of, oh my gosh, I can't even walk. There's no way I'm ever going to be able to do this again. Like, how am I supposed to squat clean 175 pounds again when I can't even bear my own body weight? So I think overall what I tried to do to stay mentally checked in to life really was I tried to find other forms of activity that I could do without pain. Was slim to none. But I pushed through some of that because I needed it mentally.
Yeah.
And so that was kind of a hard line to find.
Yeah.
So a lot of the times I would just sit on an assault bike and just pedal.
And I think at times like that, I remember telling you, like, look, if you need to get some form of energy out, here are some things that they might not feel good, but they're not going to hurt you.
Right.
And so like a squat clean at the time would have hurt you.
Yes.
Or assault biking might not feel great. But there's little there that would have negatively affected your long-term outcome.
Right.
And so sometimes it's like, hey, listen, knowing what we know with the data we have, this is what I would recommend. So like you can get that out without flaring or without prolonging the actual injury.
Right. Right.
When did you start to feel better, and what helped kind of like take you there?
Yeah, great question. So I actually did start doing hot yoga because I wasn't able to work out at the intensity that I was hoping for.
Yeah.
So I started hot yoga in hopes that it would help me like sweat it out, essentially. And I'm actually still continuing hot yoga. Turns out I kind of like it sometimes. But really when I started to feel better was I had been doing a little bit of traveling. So, you know, it's hard to stay in routine and work out all the time whenever you travel. So I do honestly think that resting as much as I did, like not lifting weights, not squatting or hinging, I do think that those things really helped like rest and heal my back so that I could come back and try those things again. So the combination of, I think, some heat and some movement in yoga, and also the combination of like resting, like staying off of loading, for a little while. So I started to feel better right after the Olympic trials.
Oh, when you came back from Minnesota?
Yep, when I came back from Minnesota. And right after I came back from Minnesota, was it that next weekend? I had like a bachelorette party or something. Right. So I was like back-to-back weekends of like no working out or little to what I'm used to. And so after that, after I came back, I had an MRI scheduled for my back because I was in so much pain still. Right. I come back from this long weekend and, you know, I'm like, oh, my back doesn't hurt when I sneeze. I'm like, wow, that's awesome. Yeah. I'm like, great. I have an MRI. That's awesome. I'm still going to go to it even though I'm in a smaller amount of pain. So I do get the MRI done, and Turns out I do have 2 mild bulging discs at L4, L5, and L5S1.
Right.
Also with mild degenerative disc disease.
Right.
And so I think for some people, those words would scare them. But for me, I felt so much relief.
Validated.
Yes, 100%. I felt validated. I'm like, I knew there was something wrong. I just couldn't, diagnose it myself. Right. So.
And I remember we were teasing with that.
Totally.
Like you and I, when we were trying to like figure out what was going on, I was like, I think this could be a thing.
Yep.
This might be an option. Like, we don't know. Let's see what the MRI says.
Yes. Yeah. And so after getting that MRI, I mean, granted, my pain was already pretty low at that point. It was probably like a 3 out of 10, maybe a 2 out of 10, really. After getting that MRI and realizing what's going on, it started to turn my focus a little bit more towards, okay, this is not so much a mental barrier. This is a physical barrier, and it's something that you can work through.
Almost like we have an issue that we know, and now we can fix it.
Yep, exactly. My brain is very data oriented.
Yeah.
I like to have all the facts. I like to know what hurts, what doesn't. If something's out of place or whatever.
Yeah.
I like to know all those things so that way when I'm doing movements, I can pay closer attention to those things.
Yeah.
And so ever since then, I've definitely eased my way back in to CrossFit and lifting and trying new movements with the help of Everstrong Therapy, of course. And so far, my back has been no more than a 3 out of 10 for pain.
Dope.
Yeah, which has been amazing. I mean, seriously, like 12 out of 10 was at its highest.
Yeah, and not for nothing, and I know this from experience. So like, and when I talk about my course of care with you, like I remember seeing you through all these points of your journey and just pointing the scale, because there was a time where even I was looking at it going like, fine, like literally we look at like put the fire out first and then you can build resiliency. And I was like, we're just trying to put the fire out for a long time.
Totally. It was a long time.
And so I say that to say you are still at 3 out of 10 pain, but you are doing so much more than you were. Like,
oh my gosh.
Are living your life again and doing CrossFit and coaching. Like not only has your pain diminished, but your level of activity has gone up. And we look at both of those as like progress.
Totally.
Right? Like how often are you flaring? What is the intensity of flares? How long do they last? How much are you doing? What does it take to put you like all of these things show progress.
Totally.
And you are at least now having and I think you were there. Like you and I at some point, and we'll talk about your PT course of care here in a second, and like what are some things that kind of helped nudge you along. And I think you were right in that like rest was the big one. I remember you and I had a conversation about stress and like stress's relationship with back pain.
Yep.
And trying to correlate when your back pain was high, because you had good days and bad days.
Yep.
And I remember trying to find patterns in like, okay, how can we predict when you're going to have a good day, and how do we predict when, not necessarily a bad day, but how do we predict when you are more sensitized to pain?
Right.
And for a lot of new research, it's coming down to like stress levels. For those that don't know, Cheyenne's getting married later this year. And so her stress level is particularly high.
Yep.
And
sure
so,
is.
and so we spend a lot of time, I think different than most of my normal cases, which is again, data driven and like, we're going to progressively overload. I think for you, given your history of being a coach and kind of being a little bit more aware, a lot of our sessions turned out into like education based, which is like, how are we managing this together, and what are your avenues of relief? And like, how are you going to slowly and controllably progress yourself? Like, how are you going to get from happy baby, half modified on a wall to walking?
Right.
How are you going to start to introduce yourself back into coaching? And what are some patterns that we notice when things get rough? So, for those, like, if you don't take a holistic approach, because I remember asking like, hey, how's wedding planning?
Yep.
Like, how are all of these normal stressors that you might, and like perhaps in normal PT settings, they don't talk about that because they'd be like, your back hurts. We're going to talk about your back.
Right.
And I think for you in particular, I remember noticing a trend with regards to your overall stress level.
Totally. Yeah.
What do you think was the thing that, like, do you think it was physical rest? Do you think it was stress rest? Like, what do you think was the thing that, like, helped? Or was it both? Like, it could just be both. Thing that, like, or just giving your body a chance to, like, different environment. Like, completely different environment, which is not, like, being it, even though we love CrossFit X, it's like being there is a reminder of your pain. And so you had 2 weekends where you're in Minneapolis, and then you're at a bachelorette party, and just the different environment and different things means I can, like, completely put it on my brain. Mm-hmm. Do you think all of that played a factor as well?
Oh yeah, 100%. I really do think it was that change in environment. I think that one actually speaks the most to me, going through this healing process. I think, yes, it was hard mentally to be at CrossFit.
Yeah.
Whenever my back was flared.
Because all you see is your limitations.
Exactly. You know, I'm like, oh man, like all I can do is sit on this bike and sit on a box and push some weights overhead.
And see this little family you've created do all the things.
Totally.
Yeah.
Yeah.
There's this graph, I don't know if you've ever seen it, of like of what back pain is and like all the factors that affect back pain. Mm-hmm. Have you ever seen it?
I haven't.
It's like thousands of things. Psychosocial, the physical, like all these things.
Yep.
And sometimes the avenue with which you like get off the hamster wheel is different than you might think. Like I have tools, physical tools that we use in PT to like get people off the hamster wheel of pain, but sometimes it's not that. And sometimes it is a conversation about stress, and sometimes it is a change in environment, and sometimes it is these things that then allow you to access the physicality like from the other way.
Yeah.
It's an interesting concept, and I'm glad that like you were able to. I'm glad that you had a bachelorette party, and I'm glad you went to Minneapolis because you know what, like I think you would have gotten here, but I think we would have been hunting for the way around it when it was like presented to you.
Yes. Yep. I agree with that. That change of environment really was helpful, and I think it was more of okay, maybe I just need to get out of my normal whatever. Like my normal routine, like my workout routine, like work routine.
And now you're doing hot yoga.
Yeah. Now I picked up a new little hobby.
Yeah. So if you were like talking to somebody, let's say in your worst point, you're talking to yourself. Mm-hmm. You're talking to someone that is 12 out of 10 pain, can't walk, can't do whatever. What would you invariably say to that person? Like if you were to now being on the outside of it, like do you have tips for your future self, or do you have or your past self, or do you have tips for the person that is like in your shoes? You're in your mid-20s.
Yeah.
Like you're young.
Yeah.
You're a little
I'm a baby.
Super active, and now everything has been like snatched away.
Yeah. Really all I have for advice is listen. Like really listen to your body and what it's telling you. It's not lying. I actually read this thing whenever I was in the grunt of my back pain, and it said, if you don't take a break, your body will break for you.
Ooh.
And that's exactly what happened to me. I needed a break, not just from workout, but from work, from life routine, all of those things. I just needed a break.
And your body forced it.
Yeah, my body totally forced it on me.
That's interesting. Mm-hmm. Do you think do you think that this would have been, I mean, I guess you're very smart with your training. So there's not like hey, could I have mitigated this more?
No.
Do you think in the future now you're more aware of do you think it makes you more aware of your back pain, or more aware of like the outside stressors in your life as far as like learning from this experience?
Yeah, I think in my day-to-day, I think about my back and how I can prevent the pain better. Mm-hmm. However, overall, looking throughout my whole experience, I do think if something similar were to happen to me or to someone else, I would have a better grasp of the whole picture versus when I was in it.
Yeah.
So I do think seeing the whole thing, physical, like emotional, social, the whole thing, I think seeing that gives me a really good like leg up on if this happens to me or someone else. That's how I can like help give advice or work myself through it again if it's me.
Yeah.
Yeah.
I mean, I'll tell you, working with you, it was interesting for me because I did learn a little bit about all those other components. Like you, I'm more data driven and more research driven and more like, oh, flexion bias, extension bias, this, that. Like, let's figure. I'm a puzzle solver. Like that is what especially working with high level athletes that are trying to perform and do this. Like, I need to squat clean 225 pounds. I need to do this. And right now I'm here. And how do we make a linear progression from here to there? Or how do we make a progression from here to there? And so working with you, I remember there's like these themes of like stuff you learn, and it changed my treatment from like to become a little bit more holistic in that like, or more all encompassing. Yeah. And to not be afraid of those conversations around stress and all those things, because they do play a factor.
Totally.
Like, have you stepped away? Have you changed your environment? Is your environment affecting this? Like, I remember working with you and being like, holy shit, like I got a few people in back pain. Like, I wonder if my results aren't what I'm expecting them to be, to make sure that if they're not trending in the way I'm expecting them to give space for those other avenues. Because sometimes all you need is one thing to get you off the hamster wheel. Yep. And then you can get into like, don't get me wrong, I'm a believer in strength and physicality and using it as a rehab mechanism. Yes. But sometimes the thing that gets you off the hamster wheel of pain and the thing that you need to feel relief to then allow your body to use the physicality to rehab you might not be physical to begin with. No. Right. And I think that's exactly what happened to me. You know, me and my body and my rehab previously has always just been physical. Yeah. Like strictly physical. This back pain added a whole new twist to it. Yeah. And so that was something I had never experienced before. And I'm just really thankful that you were working with me to figure out how to get off of that hamster wheel. Cause, I just remember there were appointments where I'd come in and I would sit and cry the whole time. Yep. Just because of the load that I was carrying, not necessarily because of my back pain, but other factors that made my back pain worse. Yeah, it was you're stressed and you can't relieve the stress. Yeah. Like we talked about in the beginning, right? Like your avenue for stress reduction is gone. Yeah. You're planning a wedding. Yeah. You have 3 jobs. Yep. You know, you have all these demands on your time. I remember your car. Oh yes, and then my car, yeah. Yeah, so like all this stuff, there's like one thing after the other, and if the avenue that you always rely on is taken away, what do you do? Yeah. And so I mean, you've come such a long way. A very long way. And I'm proud of you as a person, and 2, you've taught me again how to be a better clinician. So I appreciate that. Oh, thank you. And you were the first person on the podcast. I know, how exciting! This is dope. Okay. Yeah. Do you have anything else you want to share? I mean, the only thing I can really share is don't let anyone tell you that you're going to stop doing what you love to do. Listen. Amen. Yeah. What? Yeah. Way to end on the like. Including yourself. Don't let yourself tell yourself that. Like that's what went on in my head a lot, and it really got me down into that dark place. There's always a light at the end of the tunnel, whether you see it or not. I'm just going to mic drop that one. I'm going to leave a moment of silence for that. Cheyenne, thank you so much. I appreciate you being here. I appreciate you talking. Yeah. And this was so fun. It was fun. Thanks for having me. Thanks a lot. Yeah. All right. I'm gonna call it here. Thank you. And maybe I'll talk to you on here again soon. Yeah, probably. I fucked it up. We didn't record anything. We had to do the whole thing over again. Bye. Bye.